Welcome back to the Liberty Perspective. I'm Joe Marshall. I'm going to be picking up on this show where I left off in the last show, which was on the public health and polio. Polio as in the mass vaccinations of polio is in the 1950s, of polio in the 1950s of the Soviet Union and Eastern Bloc communist countries, right? As the upside of communist totalitarian regimes. And it was the public health, their collectivization in the public health, communization of public health across worldwide. It became the inspiration for public health on a global scale, including in the United States. But I'm going to be continuing on that, laying out more evidence or results of my investigation into is what I'm seeing happening, or is it just my imagination? You know, but anyways, I'm going to continue. We left off kind of the last show here, the Hungary and how things were going in Hungary in 1950s. Remember, we talked about the Hungarian Revolution in 1956. All this was going on in 1959 when they started the mass vaccinations over there, first country in the world. The Hungarian dictator, puppet of the Soviet Union, right? They had their Red Army in there, and they were under the gun, the tank guns at that, right? And his mass vaccinations were the continuation of this communization of Hungary, or Eastern Bloc countries under Soviet rule. Yeah. But anyways, they were saying the Hungarian success in the polio vaccination was thus... Let me see if I can share here. What we got here? You see that? Okay. This is where... Well, we went over this a little bit in the last one, so just bring us up to date here. The Hungarian success in the polio vaccinations, those mass vaccinations, right, was thus celebrated as a triumph, according to this history, was celebrated as a triumph of an entire system of political ideology. So it's tied to the ideology of the entire system of political ideology, welfare, and economic structure. Well, it's not going to be capitalism, right? It became the ultimate proof of the superiority of communist values in its system. This is what I'm getting at. This is kind of the whole, where I'm going with this whole thing, is I'm not making this shit up. It's right there. It's right there, you know? The ultimate proof of the superiority of communist values. This is where I'm getting, you know. This is where we're getting with this whole thing. And I got kind of into this a little bit, but where I want to pick up is that the global push for population public health as a result of the polio mass vaccinations, right? Public health, socialization of health, which is what it is. You have what they call the social determinants of health. I mean, how did that become a thing without the socialization of medicine? You know, what is public health? So, what is the definition of public health? Because what I'm saying is that public health is, in short, the communist healthcare, is population collectivist, world socialist. Maybe it doesn't have to be worlds, but socialism. It's a socialist healthcare system, but it's being promoted on a world scale, a worldwide scale. So it's world socialism, even if it's nationalism. Because as I've gone over before, if you're a nationalist, well, I'm not the world socialism. Well, nationalism in the greater evolutionary dialectal picture is just another world socialism in the making, because all the nations are going to fight together in their thesis, antithesis for the ultimate thesis, or the answer of who is going to be the superior power in the world between the nationalism is just another battle between them to see who's going to win to be the single global human, in charge of the single global human organism. It's just what it is. But that's doctrine. That's not me. That's not an opinion. That's an observation. But we wanted to find out what public health is. Okay, what's the narrative on public health, right? So I went to Wikipedia. And we want to find out what the narrative pushers want us to understand, or what the knowledge brokers want us to understand is public health. Well, or for anything that matter, then we go to Wikipedia, good place to start. Public health is the science and art of preventing disease, prolonging life, promoting health through the organized efforts of an informed choice and informed choices of society. It's not your informed choices and what you do between you and your doctor. It's the informed choices of society as a whole, organizations, public and private. So now we're into a public-private partnership here, I guess. Communities and individuals, where, of course, in the collectivism of such a population-based health or public health, the needs of the individual would be subordinate to the needs of the planners and, of course, the greater collective, right? Whatever that collective is. Yeah, they've got this guy. That's from this guy C.E. Winslow. They got this guy C.E. Winslow here. This is the guy that they say is like the father of public health or whatever, right? Okay. What's his name? C.E. Charles Edward Winslow. Okay, I got this Bridge Between Public Health and Primary Care. This was written by Roy Grant in 2012. This is a published paper, a white paper, and he is out of Children's Health Fund. Not to be confused with Children's Health Defense, right? Anyways, from 2012. In Winslow's classic 1920 definition, public health is the science and art of preventing disease, prolonged life, and promoting physical and mental health and well-being. Winslow, the untilled fields of public health, and that was his book or paper, The Untilled Fields of Public Health in 1920, which was right in the heart of the progressive era, okay? Public health efforts enhance the capacity of community and society to maintain and improve personal health. Of course, with that collective, eventually here and there's going to be some kind of push for universal health care, right? By the 1940s, the role of public health agency was clarified to include a minimal set of basic functions, maintaining vital statistics, environmental sanctions, example, rodent control and housing inspection, controlling communicable diseases, immunizations, and surveillance, improving maternal and child health, prenatal care, home visits, school nurses, and the health education for personal hygiene and guidance on when to seek medical care. That's all you need is a state system giving you guidance on when to seek care when it's just at the state expense that you're getting the care. You know what I'm saying? Well, anyways, primary health care, okay, an individual's usual source of care for preventative health medicine. So that's the other thing. Public health is this preventative thing. Well, we're going to tell you all these freaking scenarios, and then you're going to have, in order to prevent these things that aren't really happening yet from happening, you're going to have to comply to A, B, and C. Which the old, individualized private medicine kind of thing was like, if you're sick, you go to a doctor. What can I do to get better so I can get back on, get back to work, man, make things happen, right? Or get back to doing whatever I'm doing. But now, the public health narrative, that's just another aspect of what is public health. It's kind of a switch to focus on preventative medicine. But, primary health care, an individual's usual source for care for preventative health services, acute care, chronic disease management, specialist referrals was generally developed outside the operational sphere of local government. Public health agencies. The major exception was public health responsibility to provide indigent care. A primary care systems developed in a free market economics context. As primary care systems developed in a free market economy context, a dichotomy emerged with public health functions. There we go. So now this is this article right here, published in a white paper, admitting to you, saying to you, according to the official narrative, that there is a conflict between free enterprise, free market principles, which would be our private property, which would be associated or based on our individual right to private property, right? There's a dichotomy that emerges with public health and our primary care system. The divide between these systems began to break down in the 1960s, okay? A period of increasing focus on social justice. And social justice, including health equity. It was during this time that a new safety net healthcare system was developed to include indigent care community health centers. That's history, according to this white paper. And this guy, Roy Grant. But anyways, this other thing too I wanted to talk to you about is this specialist. I can remember when Obama was running for president. I don't know whether it was his first or second, term. I don't know. But he was out there when he was pushing his Obamacare, which was Hillary Care before that, if you don't remember. But he was pushing Obamacare. It eventually became Trump Care. But anyways, he was pushing Obamacare. And one of the major things about it was, well, you can keep your doctor if you wanted. He was pushing the government-run healthcare system, and all the mandates that came with it, right? But one of the main pushes that he set, one of the main things about that push that he was referring to constantly was, the specialists, the specialization. We need more specialists. We have to have specialists. Which, now they're not going to have a doctor where you can go to your doctor and your doctor can help you out with pretty much, he knows how your whole body works together with different things. But then, you'd have a specialist that, liver, eyes, brain surgery, this and that and the other thing. But what they kind of did is they took it to the next stop where they effectively siloed the whole of medicine into all these different expertise, different specialties, where to the point where I've said before, kind of, hyperbole a little bit, but, we've had it happen to ourselves where we go to a doctor and ask the doctor a question. Well, that's not for me. That's for that other specialist. I mean, to the point, really, where if you're got something wrong with your left arm, you go see the doctor and you start asking him questions, and he says, well, that's about this arm's happening over here or whatever, and this is happening in my arms. He says, well, you're going to have to go to a right arm specialist to talk about that. It's getting to the point where you can't, you know what I'm saying? But that's where we are. That was purposefully done that way. We have to go to specialist after specialist after specialist, and a lot of times once you go to a specialist, even when you're referred to, your insurances are going to push back. Your insurances are going to push back. Well, you didn't need a specialist. Well, the doctor said I was. Well, the doctor's just a healthcare provider now. He's not the actual medicine in the room, and maybe he made a mistake as the centralized protocol. And we're not seeing any need for you to, The potential problems with that case, as far as individuals are concerned, what our personal medicine, personal health care is concerned, gets overshadowed by the inherent collectivism of public health. So it's right here. It's primary care systems developed in a free market context. A dichotomy emerged between public health functions and your personal needs. Yeah. It was during this time that a new safety health net and care system was developed to include indigent care, which is, people can't take care of themselves, I guess, community health centers. A contemporaneous effort to move primary care outside of medical offices was community-oriented primary care. So now instead of having personal, care between you and your medicine, or private medicine between you and your doctor, now they're going to have community-oriented primary care. The community-oriented primary care model combined public health models with primary care practice. Instead of only treating individual patients, primary care providers, not doctors anymore, identified community-wide healthcare problems and developed community-wide healthcare problems. We're rolling in a few social determinants here and there, right? Social determinants. And develop strategies to address them with the community-oriented primary care. Primary care not only would improve individual health, but also improve community health and well-being, an essential public health goal. They throw that individual in there, but they roll the word individual in there. But you got to remember, once you put that word individual or any individual, you, me, anybody else, into once you roll that in, you have to roll it in the context in which public health comes, which subverts the individual to the needs of the collective, or to what best benefits the planners of that collective. It's relative, Of course, subject to change according to the needs of the planners. You see what I mean? But anyways, we've got CO, the community-oriented public, primary care model proved economically unsustainable. Yeah, who's going to fund it, right? But the goal of developing primary care services that contribute to meeting public health care goals remained. The Affordable Care Act of 2010, Obama, right, has provisions that support and expand healthcare homes, funded demonstration projects, development of reimbursement mechanisms to sustain the model, a shift in focus from treating illness to promoting prevention, that's what I was saying, and wellness, and an inclusive definition of primary care provider. Can you see the key words, the power words, the doctrinarily placed words? That's there. Yeah, a shift in the focus from treating illness to promoting prevention and wellness is an inclusive definition of primary care provider that supports, among others, nurse practitioners and physician assistants. A lot of nurse practitioners out there now. All of which have been. What's the matter, P? All of which have been redefined in the context of public health collectivism as providers. They're no longer the medicine in the room, just a conduit through which the centralized protocol flows. You don't want to let the centralized protocol flow through you. You object to that, then just like a piece of plumbing, you're going to get cut out and replaced. Come on, P. P's got to go in there, kid. He's hurt a cat or something. There you go, kid. She's on point today, It's a cold day out there. But anyways, so we're kind of in here snuggled up, ain't we, Pete? But anyways, here. She might have something to say here in a minute. I don't know. Take over the mic on me. But these innovations Yeah, shifting the focus from treating illness to promoting prevention and wellness in an inclusive definition of primary care provider. These innovations are accompanied by an emphasis on involving communities in healthcare planning. This is the public health. So we're not making this shit up. It's right here in a white paper, right? While heated debate over health care, this is back in 2012, it's not that freaking long ago. While the debate about health care reform continues in the political sphere, right, our health care systematically is systematically being reformed. You know, I might use the word hijacked. Through the expansion of healthcare homes for the indigent, right? This has already begun to contribute to meeting several of the American Public Health Association's overarching policy priorities, improving access to care for all and reducing health disparities among different populations, among the different populations of oppressed people that are oppressed, of course, by the dominant society, which is America is founded. Disparities. It's a word put out there by the critical theory that's behind promoting all things critical of America as founded or critical of any society targeted for destruction. It just so happens that in this case it's ours. And really the whole of what once was the Western free world, if ever there really was one, you know. We got one from Yale News. Public health giant remembering the man who launched public health at Yale. The Yale School of Public Health. A lot of these schools of medicine now are schools of public health, right? Is celebrating its 100th anniversary. Here, a look at the man who founded the department that eventually became Yale School of Public Health. This again, it's the CEA Edward Winslow who launched the public health care, right? Got this article on him here. Yale News. You can see up here at the top it says Yale News. You know, the Yale School of Public Health is celebrating its 100th anniversary. But anyways, that's him. That's that Winslow guy. I just want to put it out there that they celebrate this guy and just a little bit of history on what public health is and where it came from and who some of the players were. You know, main players. I Googled disease in the 20th century in Russia, Hungary, Eastern Bloc polio, and AI. Here's another thing. Going back to Hungary, okay? This is kind of just a little diversionary here on a little bit of history on what public health is. But going back to what we were talking about, what was going on in Hungary, you know, the mass vaccinations for polio and how, you know, the whole top-down command and control of, you know, which was the upside, considered to be the upside of totalitarian regimes, you know, the mass vaccinations for polio, right? But they have a lot of things that were going on over there. But I Googled what disease, just to see what was going on. Disease in the 20th century, Russia, Hungary, Eastern Bloc polio. That's what I Googled. And AI responded with this. In the 20th century, polio was a major public health threat in Russia. So this is what they want us to know. This is the narrative, right? It was a major public health threat in Russia, Hungary, and the Eastern Bloc, leading to significant epidemics. It led to significant epidemics, particularly in the 1950s, right? So it was particularly in the 1950s that this public health threat in all these Eastern Communist and Eastern Bloc countries in the Soviet Union led to significant epidemics. This is what we want to know. Forget anything else that's going on there, right? It was polio. Polio is what led to things. Kind of like with Lysenko. Lysenko got blamed for all the starvation that was going on. That actually was just the implementation, just the Red Army coming in and enforcing the dictates of the communist regime, right? Same here. Polio. It's what caused the disease. No, nothing related whatsoever to the disease or, problems in public health being anything related to the tyranny and repression and depraved starvation of its own people that was going on over there, right? But anyways, so I asked, what the hell else was going on over there in the 1950s, right? I Googled what was happening in Hungary in the 1950s. AI responds. The 1950s Hungary was a Soviet-controlled communist state that endured a difficult period of political repression and economic hardships, culminating in the failed Hungarian Revolution of 1956. The decade began with the authoritarian rule of their puppet and continued with the attempts at liberalization. The year 1956, widespread protests, which was the revolt against the communist, invasion or communist takeover of the country, right? It led to a full-scale revolt against Soviet influence, but the uprising was brutally squashed by Soviet tanks, resulting in thousands of deaths, mass arrests, and significant refugee crisis. The significant refugee crisis that was caused by the totalitarian regime enforcing its authority, right? The communist takeover. So when you ask the question, what was happening in Hungary in the 1950s, it tells you, But so there you have it, right? They have this guy here. That was the communist dictator. Kind of has a Hitler mustache there a little bit there. The communist dictator in Hungary. Okay, Hungary is one of the oldest states in Central and Eastern Europe. Had its first communist experience in 1919 when attempts to impose a communist regime spread chaos and brought the country into verge of disaster. So all this shit's happening over there when, you had the 1920s, 30s, 40s, and 50s when, also the Lysenkoism was going on over there, right? I mean, you had the Bolshevist Revolution in 1917, then you had Lenin, then you had Stalin, then you had, right? The following 2 decades of peaceful development ended when the Soviet Union occupied Hungary in World War II and used military threats to set up a communist government. Any resistance to communist authorities was met with violence. In 1945 to 46, some 35,000 people were arrested on political grounds. But if we listen to AI just, before that, they were telling us that it was the epidemics that were happening in the 1950s at the same time. This is when those epidemics, it was the epidemics, man. None of this other stuff, right? Some 35,000 people were arrested on political grounds and 1,000 of them executed or tortured to death. That doesn't put anybody under any kind of stress or a population under any kind of stress, right? I'm sure that they had running water and all the hygiene that they needed to, be healthy people too, right? Under all these conditions. Yeah. I was reading somewhere, I said, even today, I'm going to be doing some more research into this, but, even sanitation in this country here, most of the houses didn't have running water until into the 50s or 60s. And in Russia, I mean, there's still a lot of houses that still, within the past few years, still didn't have running water. I mean, how's that play into the spread of disease? Because with running water, I mean, the whole hygiene thing kind of takes an upgrade, you know what I mean? I don't know. Yeah, 1,000 of them were executed or tortured to death. Another 55,000 were detained in concentration camps. Communist command economy was established, hindering the country's development. The church suffered heavily during 1956 revolution. Hungary tried to break from the Soviet sphere of influence and restore democracy. But the uprising was crushed by Soviet tanks. At least 2,500 Hungarians died in a clash, and 200,000 fled the country. Geez, I wonder how that affected the epidemics. You think it was still polio that was killing most of those people over there? Or I don't know. At least 2,500 Hungarians died in clashes and 200,000 fled the country. Communist authorities arrested some 26,000 people and 350 were executed. Yeah, we go back up here and AI tells us, that in the 1950s, Hungary was a Soviet-controlled communist state that endured a difficult period of political repression and economic hardships. Okay, it tells us that, but it also says this. Where were we? Polio was in the 20th century. Polio was a major public health threat in Russia, Hungary, and in the Eastern blocs, leading to significant epidemics, particularly in the 1950s. Do you think it was polio that led to them epidemics, or is it maybe polio is just... I don't know. Look at all the other shit that was going on over there, right? This is just in Hungary. I came across this Proud and Torn, kind of a personal history of some people that lived through this, and I kind of went down through this a little bit, and I picked out a couple of things that I thought maybe I'd share with you, and you can go to that article and read it yourself and check it out. This is as a visual memoir. Proud and Torn tells the story of the ups and downs over generations of an everyday peasant family from the Hungarian countryside. Hungry. Yeah. The digital project features nearly 1,000 images, many of which have never been publicly viewed before, alongside graphic maps and drawings to make the complicated story of Hungarian and Eastern European history accessible to anyone from children to adults. The 1950s socialist utopia. This is a Proud and Torn thing here too. Okay, we go down through this, and they have pictures of this family. Yeah, where the stories of how these people and their family came to be imprisoned and were sent across the country and enslaved to work in work camps and prisons. Okay, it was this 1950s socialist utopia. Sorry. Because the Rákosi regime had labeled my grandfather a kulak, which was kind of like a bourgeois or petty bourgeois farmer that wanted profits from his business or something. A saboteur and an enemy of the state, the authorities had imprisoned him and assigned him to hard labor because he was a farmer, or I don't know. That's what they called the kulaks in Ukraine at the time. Yeah. Pista endured a terrifying 2-year journey that tested his abilities to survive. He was, 1, tortured and jailed at Kaposvar, and 2, detained at the notorious Krastarka internment camp. This thing, they have maps too on this, which is, let me see if I can show you one. See, they have maps where they pull out the places on these camps, or where these camps are located, concentration camps are located, and they have lines here where they say he was shipped from one concentration camp back to another concentration camp or prison or whatever. So it's pretty. They lay that out so you get an understanding what's actually happening and where, But yeah. So Krastarka, I don't know if I'm pronouncing that right, began as an infamous concentration camp for political prisoners during the Horthy era. Then it was used to house Jews during World War II before they were sent to Auschwitz, and held Arrow Cross collaborators after the war. By 1950, Christarxa had been repurposed again to house 2,000 to 3,000 opponents of the Hungarian communist state, mostly political dissidents. In the 1950s, where polio was a major epidemic, right? Prisoners slept like sardines on the floor, only 20 to 23 inches allowed per person. Wouldn't have any effect on the spread of disease, right? The Soviet Politburo gave Hungary's dictator a long leash to do terrible things to wealthier Hungarians. From the Soviet perspective, Hungary needed to be strictly disciplined in order to eliminate its social backwardness. All right. It was overrun with social backwardness. That's how they see our founding principles. It's how they see our Constitution. That's how they see an oath of anybody in office, and a sworn oath to our Constitution is social backwardness. It was overrun with class enemies because of the aristocracy longevity as political leaders until 1945, and the unholy union with Jewish capitalists. Yeah, Jews and capitalists were kind of associated together the way, whites and whiteness of America and capitalism is associated as the same thing today. It's the same shit. It's the same shit. You can read down through this doctrine. You can read Helfin's, Judy Helfin, I think was her name. She's the one who kind of came up with the main article was just called the whiteness of America, or just whiteness. Helfand, Helfand. You can read down through that, and you can replace white or whiteness with capitalism all the way down through it, and it would say the same thing. Yeah, I did a show in a defense of America against the whiteness accusatory. One of the first few shows that I actually did. You could check that out if you want to look into that anymore. But let me see. Yeah. Okay, so it was overrun by class enemies because of the aristocracy's longevity as political leaders until 1945, and the unholy union with the Jewish capitalists, who had allegedly conspired to abuse peasants and workers. Yeah. Capitalism is oppressive, It's exploitive. They ordered Rutkowski to aggressively pull Hungary into line and catch up to the Soviet Union and the rest of the Eastern Bloc in creating a workers' state. Because the state, like a union, is looking out for the brotherhood of the workers. Right? You got to have a workers' state. Labor movements. My family was caught up in the punishment of an entire country. They were also caught up in Rosky's Stalinist 5-year planned economy, which was put into action in the 1950s. I mean, basically, since the New Deal in the United States was kind of undergoing the same thing when they went to Keynesian economics, which was a centrally planned economy. And once you can't have willy-nilly free enterprise, free market system. It's got to be planned. It's got to be controlled by the elites. At least to some degree, right? The agricultural plan, here's where we get into the Lysenkoism shit, right? The agricultural plan coerced families to turn over their personal farms to huge state-run, highly mechanized farming operations, because they called it the collectivizations of agriculture, the collectivization of these farms. And they took a lot of the farmers out and threw them in prison, and they left, the Red Army, generals and whatever in charge of the farms, making prisoners work the farms. Maybe they were using Lysenko policies or genetics or whatever, but it wasn't just Lysenko that led to the starvation and failure of these farms. They were government run. They threw everybody that was running them that knew what they were doing in prison. Same with the Great Famine in Ukraine, right? Same thing. The industrial plan moved thousands of displaced farm workers to mining jobs in large urban factories. Much of this heightened industrialization happened in northern Hungary. The region's workforce changed dramatically in the first years of Rákosi's five-year plan. From a modest number of relatively high-paid skilled industrial workers to thousands of semi-skilled and unskilled heavy laborers. The region's workforce changed dramatically in from a modest number of relatively high-paid skilled industrial workers to thousands of semi-skilled and unskilled heavy laborers. New modern towns like whatever, I can't pronounce this, Kinzarbika, I don't know how to say it, where the Pista wound up, these people's family member, and Totembanya, which barely existed before this period, they exploded overnight, like the gold towns of the West, right? To become big, muddy construction sites saddled with the levels of dysfunction. No water, no soap, no fresh vegetables, unreliable and overcrowded transportation to and from the work site, bread baked with particles of sawdust, pieces of wood, and pebbles. Wouldn't have any effect on disease or spread of disease or epidemics, would it? Meanwhile, life on most collective and state farms failed to deliver the great bounty through modern, efficient farming that communist ideologues had promised, including Lysenko probably, right? Workers were disorganized and often lacked proper equipment. Members were paid only every 6 months and then never enough. So there was little incentive to work hard, like the industrial workers who have been promised higher wages and better living standards. Many collective farm workers felt duped. Oh, because there's always this promise of, we're the new communist man and the new communism. We're fighting hard because the new communism is right around the corner. We're almost there, right? Morale dropped in the countryside. Agricultural output dwindled. Just because of Lysenko, you think? Those most experienced at handling larger farms, like my grandfather, were serving prison terms or doing forced labor, or had fled to the cities. Not surprisingly, food supplies to urban centers declined precipitously. Yeah, but they got this. So all this is the shit that's going on over there when polio. After working in pairs, state police and the state police and localities scrutinized every aspect of farm work. They show these two army guys in here. Interrogated collective farm members. They requisitioned grain. They counted their animals. They measured crop rows. They got two cops out there, guards, prison guards essentially, measuring the distance of their vegetable rows. They brought terror to the countryside following the Soviet roadmap. Rákosi and his regime uprooted my family and hundreds of thousands of other families across the Hungarian countryside. There's a freaking prison tower. I've manned prison towers. That's a prison tower. This was Hungary in the early 1950s in service to the Soviet Union, dismantling its past and building an uncertain new future, which is progress. That's progress. That's progressive. The Russians are coming. Okay, now I got here this picture, which is from left to right: Mikhail Chumakov, Albert Sabin, and Marina Vorshilova, which is Chumakov's wife. And this Mikhail Chumakov and Mrs. Chumakov here would later become Mrs. Chumakov, I guess, are also the parents of the Chumakov that's Konstantin Chumakov, that was recently the deputy advisor in charge of the FDA of vaccine safety during COVID, right? I don't know, maybe it's a coincidence, maybe it's just me. This was in June 1956, Albert Sabin collection, right? So I just wanted to show you that. I came across this picture on another show. It didn't have a full caption here, but this caption here, we've got from left to right: Marina Vorshilova, which would become Mrs. Chumakov, right? Albert Sabin, Mikhail Chumakov, and this guy over here, his name is Anatoly Shmrodnistev. I don't know. Cincinnati. It was taken in Cincinnati in February of 1956. Okay. They got vaccine diplomacy during World War. During vaccine diplomacy during Cold War. Heads or tails? Heads, Mikhail Chumakov, and the oral poliomyelitis vaccine of Albert Sabin. This article was written in 2024. I'm not making this shit up. Anyways, in this article, I've got my glasses right here. Maybe I can see things better. During the spring and summer of 1930, an unknown sudden onset disease was observed in some regimes of the Siberian taiga. Okay, this is a little history on this thing here, too. The disease caused severe neurological symptoms and high mortality rates. In 1935, a neurologist from, Vladivostok, this guy here, Alexander Panov, suggested that it could be a viral encephalitis. Clinical symptoms, this is in 1930, remember. Clinical symptoms included flaccid paralysis, not sure what that is, shoulder girdle involvement, and bulbar manifestations. It was suggested that the disease may be Japanese encephalitis, a viral disease transmitted by the mosquitoes, discovered in 1922. Well, if you just discover it, then all of a sudden it's the cause of everything, pretty much. In March 1937, a medical expedition was sent to the area, led by Lev. I kept calling this guy Lev Ziebler in one of my past shows. It looks like Lev Zilber. I don't know why I saw Ziebler. I have no idea. I don't know. I'm probably mispronouncing all this shit. The point is to get you the information. You can, learn the correct pronunciations elsewhere, I guess. But Lev Zilber, okay? It was led by Lev Zilber, the Jewish guy, remember? Considered the founder of Soviet virology. Now, this guy is considered the founder of Soviet virology. This is the guy, and this expedition in particular, I've already gone over a lot of the history on this thing, on how they came to go to this place and how they... The questionable conditions under which they quote-unquote isolated this tick-borne encephalitis that was over there. You know? But he's considered the founder of Soviet virology. Now, that expedition in particular, led by this Lev Zilber, sorry. you know, is considered, he's a founder of Soviet virology, but that whole expedition is key to our understanding and foundational to our understanding of epidemiology today, virology today, vaccinology today, what they refer to as nidality, which led to One Health, which is now we understand, or led to One Medicine, veterinary One Medicine, which then evolved into what we now know today as One Health, which is the worldwide codification of the tenets of world socialist revolution into the overarching global governance health laws of the world through the World Health Organization, and it's been adopted by countries all over the world, including as an official policy by pretty much all government agencies, including the United States, including under Trump. It's never been rescinded, and they've even, pushed it. They put papers out on it, which I've shown before. But anyways, it was suggested that the disease may be Japanese encephalitis, a viral disease transmitted by the mosquito, discovered in 1922. In March 1937, a medical expedition was sent to the area led by Lev Zibler, considered the founder of Soviet virology. Zilber directed the Central Virus Laboratory in Moscow, created in 1935. He created a group of 20 members, the majority enthusiastic young scientists, including the virologists Elizaveta Lakovic, Mikhail Chumakov. Anyways, Chumakov was one of them. This is my point. These scientists, many of them younger than 30 years, have been called the first generation of virologists. Chumakov, first generation of virologists. They later created the scientific schools that dominated Soviet virology for several decades. The expedition performed its research between May and August 1937. They determined that the disease was caused by a virus transmitted by tick bites. How they came to determine that? Because, as I've gone over before in that other show, which was, about Soviet, coerced Soviet virology, is that basically some woman was there saying, I think I had a couple ticks on me at that time. Oh yeah, well there you go, that's the ticks. That's how they came to figure that one out, right? Zilber named the disease Russian summer encephalitis, or tick-borne encephalitis. In only 3 months, they had discovered a new virus, isolated 29 strains in only 3 months. In the conditions that they isolated them in. A lot of these guys, some of these guys were possibly even prisoners themselves, these scientists conducting experiments on these people that lived in, I wouldn't call it healthy conditions, Zilber named, let me see. Yeah, in only 3 months, they had discovered a new virus, isolated 29 strains, identified the vector, the ticks, described the epidemiology, clinical symptoms, and histology of the disease, and demonstrated the effectiveness of serum therapy. They did all that in 3 months. Chumakov proposed vaccinating the entire population. This is on page 69 of that article. Chumakov proposed vaccinating the entire population. Vaccination centers were set up in nurseries and play schools, clinics, factories, and other places. Parents were informed about when and where to go. Local officials ensured that everybody attended the centers. So much for voluntary, right? The pediatricians were responsible for the medical side. Meticulous record keeping included all the essential data. The plan was well executed thanks to the organizational skills of Chumakov. and the coercive power of the state police. This is what came to be the setup for how the polio vaccine would be, the mass vaccinations of the polio epidemic would all become the envy of the world, right? The top-down command and control, the upside of totalitarian regimes, right? Would become the envy of the world. In Sabin's words, Albert Sabin, the American who came up with the attenuated live virus, and they attenuated it, I don't know, would they use formaldehyde or some shit to attenuate it? In Sabin's words, Russians waged a blitzkrieg, I think somebody else said the same thing, against poliomyelitis, winning the battle. The process was slower in the United States as it was not led by General Chumakov. That's what we know. It wasn't led by General Chumakov. Man, if we could only have a General Chumakov here and a public health system that was top-down command and control, we could have done that same shit here. Who was victorious, even using his left hand and with hearing aids. This process was slower in the United States as it was not led by General Chumakov, who was victorious even using his left hand and with hearing aids. Or maybe losing his left hand? I don't know. I guess he had problems with one of his arms or hands. After Sabin's lecture in Russia, in USSR, he was criticized by some attendees who condemned his ignorance of the principles of Lysenko and Mikurin. So he wasn't drinking enough of the Lysenko Kool-Aid, I guess, with which a perfect vaccine may be manufactured, okay, from the Soviet, from this Lysenko Mikurin genetics, right? As Soviet genetic principles would enable better selection of virus strains. So here they're praising Lysenko, and Sabin just wasn't drinking enough of the Lysenko Kool-Aid. Chumakov's victory helped to eradicate poliomyelitis in the Soviet Union and added a new political and social dimension to the vaccine, which was communism, right? The new political and social dimension. The upside of totalitarian regimes in communism. In the 1960s, the country was the largest manufacturer of Sabin's vaccine worldwide and exported it to other countries. It was known as the communist vaccine, a Soviet achievement that should be legitimized. Sabin publicly confronted the Soviet representatives and asked them to acknowledge whether they had developed new attenuated poliovirus strains in their vaccine or if it was a mistranslation. Despite a public apology from the Soviet delegates, Petrovsky's assertion was not officially amended. Sabin's vaccine in the world. In parallel to the Soviet Union, important trials with the vaccine were performed in the late 1950s in other Eastern Bloc countries, especially the Czech Republic and Hungary, right, which we've gone over, which had suffered severe epidemics in previous years. Now, could it be just that polio and perfectly healthy population and with all kinds of hygienes, general happiness, and people just going about their things, or that polio was under the repressed conditions that were forced upon these people, basically imprisoning them under the guns of the Soviet Red Army, right? People being thrown in prison, dragged around, forced to work, starved to death, tortured. Wouldn't have anything to do with the spread of any kind of a disease or, killing them, They test positive for polio, then they died from polio. Or if they, whatever, right? Yeah. The Eastern Bloc countries, especially the Czech Republic and Hungary, which had suffered severe epidemics in the previous years, they used strains sent by Sabin and Chumakov which with excellent results. In Poland and the Belgian Congo, vaccines were manufactured using strains of Kaprowski's vaccine. By the end of the 1960s, the oral vaccine had been used to immunize 92.6 million people in the Soviet Union and another 23 million in the Eastern European countries. That's the biggest number I've seen yet, right? We got over 100 million people mass vaccinated. The introduction of Sabin's vaccine in the United States was hampered by controversies, rivalries, and delays. Whereas the authorities needed only 2 hours to authorize Salk's vaccine, it took them several years for Sabin's. Between 1955 and 1960s, with Salk vaccine, between 3,000 and 5,000 cases of poliomyelitis were recorded annually in the United States. Sabin's vaccine was approved in 1960 and was administered to 100 million children of all ages in 1961, 62, and 62. And in 1964, for the first time, there was no new cases in summer of poliomyelitis outbreaks in the country. A mass vaccination campaign also conducted in Belgium, where the disease practically disappeared from 1963. The effects of the vaccine were also fast and pronounced in Spain and Italy. The effects of the vaccine were also fast and pronounced in Spain and Italy, although it was not able to eradicate some foci. Japanese, Israel, and Cuba almost completely eliminated the disease. In less developed countries in South America, Africa, and Asia, collective oral vaccination campaigns were performed that spectacularly reduced the number of cases within a matter of weeks in non-epidemic periods. But transmission was only partially interrupted. In the USSR, 42 million doses of Sabin's vaccine were prepared and sent to another 40 countries, mainly those within the socialist sphere of influence. The success served to show that Eastern European countries took better care of their citizens in healthcare terms. Yeah. You see what I'm saying? This is my point. The whole narrative of epidemics and vaccines, mass vaccination and public health care prevention is a model that became the envy of the world in the 1950s. Top-down command and control, the upside of totalitarian communist regimes. Man, if we could just do that here. Right? This is documented history here. All the different countries, all of them were all collectivist or communist or some form of collectivism in charge. In Israel. Right? But anyways. Yeah, this success served to show that Eastern European countries took better care of their citizens in healthcare terms. They used it to underscore their cultural, economic, and moral superiority over the West, and especially the United States. Yeah, with its convoluted market economy and racial segregation. Okay. Why was the United States not using Sabin's vaccine by 1959? The response from Albert Sabin was that since 1954, Salk vaccine had been in private hands of those who expected to obtain great financial benefits from it. So in other words, Sabin blames capitalism along with the other communist countries in the whole communist narrative and the whole communist narrative. Yeah. We don't have polio because we're communist, and you have polio or don't have this polio vaccine against polio because you're capitalist, because of your capitalism. Right? Despite adversities, Chumakov remained loyal to communism. Well, of course, you got to remember this loyal to communism Chumakov is the father of Konstantin or Konstantin, I think Konstantin Chumakov, who was just the last FDA assistant director or assistant deputy director or whatever. I can't remember his exact title. We'll be getting to that here in a minute. But of the FDA in charge of vaccine safety, vaccine research and safety. During COVID, when the vaccine was approved. You know? Right. So despite adversities, Chumakov remained loyal to communism, although he helped some of his employees to emigrate. His sons, Konstantin, that's him, Konstantin or Konstantin, right? And Alexei moved to the United States, where they were protected by their father's friends. So they were protected by other communists that he knew in the country. And then he would become, a deputy director or whatever in charge of vaccine research and safety at the FDA during COVID, when the COVID vaccines were approved for distribution. Maybe there's nothing there. Maybe there's just me, right? All four of his children with Marina Vereshlova became scientists, as did his son and two daughters from his first marriage. He also tried to convert Sabin to his ideology and vice versa. Both failed, but did not affect their friendship. Conclusion. Vaccine diplomacy was an important element of the détente and cooperation between the opposing blocs of the East and West during the Cold War. The most notable achievement was the development of the oral poliomyelitis vaccine, which saved countless lives worldwide. That's the narrative, right? The architects of this achievement were Albert Sabin. The creator of the vaccine was Mikhail Chumakov. The architects of the achievement were Albert Sabin, the creator of the vaccine, and Albert Chumakov, who in 1959 and 60 led a mass immunization campaign for children and youth adults in the Soviet Union, demonstrating its effectiveness. Sabin was not allowed to trial the vaccine in the United States, where Salk's killed virus vaccine was already in use, and Chumakov had to convince political leaders in his country to carry out this task. This was a great achievement of Soviet virology, which was exploited politically to show the superiority of socialized healthcare over the capitalist healthcare system of North America. Those aren't even my words. That's not even me saying that. That's not me saying that. Right? This is a white paper history, man. This is white paper history. Neurosciences and history. Yeah. Chumakov had to convince political leaders in his country to carry out this task, which was a great achievement of Soviet virology, which was exploited politically to show the superiority of socialized healthcare over the capitalist healthcare system of North America. It's right there. I'm not making this shit up. Anyways, I got more. Socializing primary care. The Soviet Union, World Health Organization, in the 1978 Alma-Ata Conference. It was in 1978 Alma-Ata. This is okay. Socializing primary health care. This author affiliations, Toronto. Yeah. School of Public Health, University of Toronto. Institute for the History and Philosophy of Science and Technology, University of Toronto. I ain't shitting you. Article came out in 2018. Okay? In September of 1978. A little history, a little more on the history here, right? Getting a little understanding where this whole public health comes from and how it came to be what it is. Initiated from the top-down command and control of totalitarian regimes that became the envy of the world during the mass vaccinations, the polio mass vaccinations in the 1950s in all these communist Eastern Bloc states. September 1978, the World Health Organization convened a momentous international conference on primary health care in Alma Ata, capital of the Soviet Republic of Kazakhstan. Kazakhstan? I don't know. This unprecedented gathering signaled a break with the WHO's long-standing technically oriented disease eradication campaigns. Instead, Alma Mater emphasized a community-based, social justice-oriented approach to health. Okay, this is the history. This is what they're teaching people. All right. Existing historical accounts of the conference, largely based on World Health Organization sources, have characterized it as a Soviet triumph. Such reasonings, embedded in Cold War logic, contradicts both the decision-making process in Geneva and Moscow that led the conference to be held in the Union of Soviet Socialist Republic, and the reality that the highest Soviet authorities did not consider it a significant ideological or political opportunity. To redress the omissions and assumptions of prior accounts, this article examines the Alma Mater Conference in the context of Soviet political and health developments, drawing from Soviet archival and published sources as well as WHO materials and interviews with several key Soviet protagonists. The unprecedented gathering of 3,000 health delegates, including government officials from 134 countries and representatives of 67 non-governmental organizations, NGOs, pushing the narrative, right? Signaled a rupture with the WHO's long-standing technically oriented top-down disease eradication approach. Remember, the switch when you come to collectivist public health care was a switch from prevention to or switch from addressing the disease to a prevention, right? Public prevention. And then, but they also signaled a rupture with the WHO's long-standing, technically oriented, top-down disease eradications. Now you're going to take and involve a systematic, top-down command and control, mass vaccinations, eradications approach, because the only way that could possibly be done is a communist regime with totalitarian top-down command and control. Just saying. The meeting concluded with the adoption of a set of 22 recommendations and accompanying declaration of Alma Ata calling for health for all people of the world by the year 2000. Health for all people of the world. Basically, as a human right? A universal health care system. Because you have a right to that. And the governments are obligated under the new human rights-based definition of sovereignty to provide it to you, which would make the restraints on the Constitution restraints on the government placed by the Constitution null and void, at least philosophically, if not legally. Right. These documents crystallized principles of health as a fundamental human right. I shit you not. It ain't even me saying it. An important worldwide social goal defining public health care as essential health care, public PHC. Oh, what the hell? Yeah. Defining public health. Principles of public health as essential health care based on practical, scientifically sound, and socially acceptable methods, and technically made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. So in their collectivist version of what self-alliance and self-determination is, you have to be fully enslaved to the collectivism and totally throw yourself under the bus for the good of the collective. The altruism of living for the sake of the others, living for the sake of others and according to the needs of the planners, is the only way you're going to have any way of any kind of self-reliance or self-determination. You know, Obama used to say the same shit. The guy was a doctrinarian, was a doctrinarily, by definition, communist. He might not have been card carrying there. Maybe he was or wasn't. I don't even know. But doctrinarily speaking, he was a full-blown communist. He was, and a lot of times that was the reason why he was able to kind of, bamboozle a lot of people, is because he spoke in words that we understood one way, the self-reliance and self-determination, that meant totally the opposite in the communist doctrine that he was espousing. Just saying. This is just one instance of that. Another aspect of the event's lore was the declaration censure of the gross inequality in health status between and within countries deriving from an unjust global order. What do you think that is? Capitalism? As politically, socially, and economically acceptable. Yeah. Another aspect of the event's lore was the declaration censor of the gross inequality in health status between and within countries, deriving from an unjust global order as politically, socially, and economically unacceptable. So, yeah, capitalism is just unacceptable. Free enterprise is unacceptable. Everything has to be according to the planned economy as per the needs of the central planners, subject to change according to the needs of the central planners. The conference and declaration generated enormous visibility for public health approach and its centrality to the healthcare system. The event gave impetus to efforts to reshape health policy in member countries and reorient the World Health Organization's own agenda. In 1979, the World Health Assembly, whose governing body, endorsed the declaration, and 2 years later, the United Nations UN General Assembly passed a special resolution exhorting all member countries to implement the global strategy for health for all by the year 2000 under the World Health Organization's coordination. It became the envy of the world, the top-down command and control totalitarian public health of the Soviet Union and Eastern Bloc communist countries and really socialist countries around the world became the envy of the world, and this is the history of how that envy came to be official World Health Organization policy. That's it. Right there. Right there. Right? In 1979, the World Health Organization, World Health Assembly, whose governing body, endorsed the declaration. 2 years later, which would be 1981, just since I've graduated high school, the United Nations UN General Assembly passed a special resolution exhorting exhorting all member countries to implement global strategy for health for all by the year 2000. The United States is about one of the only countries left out there that don't have universal health care for yet. Full-blown universal health care. Even though we've got Obamacare and Trump care, we still don't have full-blown universal health care. Full-blown socialist system. We're mostly there, but not all the way there. I don't know. It's a full-blown socialist system, but it's still got private actors. I don't know what the deal is. But, and that's all really changed since Obama, really. I mean, it was changing before that, but since Obama, it's not in the big picture, it's really not all that long ago that all this has come to fruition. So the Soviet Union's Socialist Republic, the USSR, was not merely a backdrop to the meeting's deliberations. Soviet officials had prodded the WHO into holding a conference and ultimately hosted and presided over it. Yeah, the USSR hosted and presided over it. During the weekend that fell into the middle of the conference, the Soviets hosts invited attendees to visit healthcare facilities in the alma mater region, and as well as neighboring Uzbekistan regions, showcasing the USSR's own socialist healthcare systems as a public health success is understood according to Soviet criteria. Conclusion. In the end, rather than representing the Cold War victory for the USSR or Soviet scheme to kidnap World Health Organization's public health agenda, the landmark alma mater conference had distinct meanings for WHO and Soviet players on what to highlight and how to achieve health for all via community-based efforts for the World Health Organization and through centrally planned health care of the Soviets. Through the centrally planned healthcare of the Soviets. This struggle persists to the present in the debate over universal healthcare. This struggle persists to the present in the debate over universal healthcare coverage, which to some presents an opportunity to resurrect and extend free national systems of universal publicly delivered healthcare. This is where we're going. The full-blown socialism of universal health care. Okay? This is where I'm going with this. This is a little history. This is documentation that shows how the top-down command and control of polio's mass vaccinations in the 50s in the Soviet Union and Eastern Bloc communist states, led by Chumakov and Sabin's vaccine, led by Mikhail Chumakov, General Mikhail Chumakov, right, in the Blitzkrieg against polio. But anyways, in the first 9 months of COVID in the UN, WHO pushes universal health care. Okay, just a couple more things here. Hang on a second here. I think we're getting here. Where are we? We're down here. Okay, going to try to wrap this up here. In the first 9 months of COVID, the UN or WHO pushes universal health care. I mean, is it a coincidence that every time we get a new epidemic that the push for universal health care comes up? And as we can see, this whole push for the WHO to kind of adopt the top-down command and control of the Soviet Union, so it's no longer just the envy of the world, it is the world policy now, right? Global policy. So now, in the first 9 months of COVID, somehow the UN, World Health Organization, comes to push universal health care. Do you think it's a coincidence? You think it's a coincidence, right? From the United Nations. Okay? Policy brief, COVID-19 and universal health care coverage. In the space of 9 months, COVID-19, this is October 2020, all right? So almost a year into COVID. In the space of 9 months, COVID-19 has spread to more than 190 countries with over 30 million cases reported. Get the cat, Pete. Over 1 million lives have been lost. Over 1 million lives have been lost to COVID, which just so happened to coincide with the population pyramid's increase of people, an exponential increase in the people over age 65 and approaching life expectancy and surpassing life expectancy. The population pyramid at the same time that COVID hit, age brackets above 65 were increasing as much as 50%. And all those extra deaths that were coming in because of the baby boomers bump in the population pyramid that's moving. I've gone over this on a couple different shows before. Dr. Jonathan Cooey, a GigaOhm Biological, has showed time and time again the effects of how the population pyramid and the baby boomer bump, in not just America, but in countries around the world. That exponential increase in people over the age of 65 and who were reaching the age of life expectancy, and that extra amount of people dying, I mean, they didn't take that into effect. They just said that you had a mortality rate, an increased mortality rate, and they blame it on COVID. You know, there's a lot of other things going on, too, during that time, right? You had the opioid increase in deaths, you know, that was enough to even drop our life expectancy in America, that doesn't get rolled into the numbers. But they can just easily say here, under the UN, they're just saying that, around the world, right? Yeah. They're just saying that over 1 million lives have been lost. How many of those millions of lives, so-called lives that were lost to so-called COVID, were actually just people, the increase in people from the baby boom bump, you know, or people dying from other causes, right? The pandemic has laid bare long ignored risks, including inadequate health systems, gaps in social protection, and structural inequalities. All tenets of world socialist revolution being put forth by the World Health Organization as giving COVID, under the guise of COVID, utilizing COVID as a lever in which to, as a lever and fulcrum, which to advance universal health care coverage, or to discredit the existing systems which should be replaced by universal health coverage, namely America's capitalist system, right? Allegedly capitalist system. It has also brought home the importance of basic public health and strong health systems and emergency preparedness, as well as the resilience of a population in the face of new virus pandemics, lending ever greater urgency to the quest for they're not even beating around the bush, lending an ever greater urgency to the quest for universal health care coverage. This is an opportunity. COVID gives the world and the world socialist revolution the opportunity to shit on America for not having universal health care. To kind of ostracize, kind of like the Alinsky tactic, where you separate and ostracize and basically make fun of your target. All right? Which is the UN is doing here. Okay. The academic push for top-down Soviet world socialist communist-style public health continues while calling out America specifically for not getting with the program. You know, when we're in prison, you hear that a lot. When in prison, you have inmates coming up to you, and they complain about this, they complain about that, you know, all the time. It's just, you know, just run-of-the-mill shit, right? And they don't like this or they don't like that about prison. Say, listen, get with the program. Get with the program, man. Just get with the program. And that's basically the single most handed out line of advice that I probably give inmates over my whole 25-year career is just, you're going to have to get with the program. Get with the program. You know, you jump in the stream, it's easier. You try going upstream. When you're in a prison system and your whole day is regimented, you gotta get with the program. You buck the system, you're not gonna be easy. You're gonna have a rough time, you know. Yeah. So now you've got an academic push, the academic push for top-down Soviet world socialist communist style. Remember, which has now become the envy of the world, and right. Continues while calling out America specifically, not just for not getting with the program. So I got this article here: Universal Healthcare as Pandemic Preparedness, the lives and costs that it could have been saved during the COVID-19 pandemic. This article just came out in 2022. Okay, while we're in the middle of COVID, while we're in the middle of all that shit, right? We have here affiliations. Let me see what we have here for affiliations. Public Health, New Haven, Connecticut. School of Citizenship and Public Affairs, Syracuse University. Department of Economics, College Social and Behavior Sciences, University of Massachusetts, California, Florida. Center for Vaccine Development and Global Health at University of Maryland School of Medicine. Yeah. But just to give you an idea where this article comes from, the significance here, okay, of this article, they're saying the fragmented and inefficient healthcare system in the United States leads to many preventable deaths and unnecessary costs every year. Universal health care could have alleviated the mortality caused by a confluence of negative COVID-related factors. Basically, they're blaming the deaths, many preventable deaths, and all the deaths that were preventable, they're blaming, that they're saying were preventable, they're blaming the United States for not having universal health care coverage. The Cuyahoga County Health Department here in upstate New York, as a derivative or subsidiary of New York State Health Department, issued a paper in which, which I'm going to show sometime, issued a paper in which they lay it out that they blamed, the health department officially blamed 250,000 deaths on the unvaccinated. That was the narrative. A piece of paper put out by the Cuyahoga County Health Department here in upstate New York, blaming 250,000 deaths on the unvaccinated. Here you have these professors blaming all these deaths on the fact that we don't have universal health care coverage. Either way, get with the program. You're not getting with the program, man. America's not with the program. Coincidentally, we get to use yet another epidemic, viral or some other pathogenic epidemic, to push the global revolution and, of course, the universal health care coverage that would come with it. Just saying. Incorporating the demography of the uninsured with age-specific COVID-19 and non-pandemic mortality. Incorporating the demography of the uninsured With the age-specific COVID-19 and non-pandemic mortality, we estimate that a single-payer healthcare system would have saved 212,000 lives in 2020 alone. We also calculate that $105.6 billion of medical expense associated with the COVID-19 hospitalization could have been averted by a Medicare for all system. Really, I wonder how many of those people were part of the unmentioned or brushed off baby boom bump in the population pyramid that exponentially increased the population, the percent of our population in the age brackets that were 65 and older. As much as 50% in some cases. I mean, I did shows on this. I've done shows on this that show this. And, but anyways, I'm just putting this in here to show you that now you've had the World Health Organization calling out, everybody because of COVID, for not having nations across the board in general, for not having universal health care coverage. You've got these professors, public health, professors and universities calling out the United States specifically. COVID was an opportunity to shit on America. Get with the program, get with the World Socialist program, and adopt universal health care coverage. Right? Yeah. We estimated a single-payer universal health care system would have saved 212,000 lives in 2020 alone. Okay, in the abstract, we estimate that a single-payer universal health care system would have saved about 212,000 lives in 2020 alone. These economic benefits are in addition to the $438 billion expected to be saved by a single-payer healthcare, universal health care during a non-pandemic year. Wait a minute. We also calculated that $105.6 billion of medical expenses associated with COVID-19 hospitalization could have been averted by a single-payer universal healthcare system. See, one of these things that they do is they say, America spends this much money on healthcare. They spend so much money on healthcare that, yet we have the worst health outcomes, supposedly, according to the accusatory, the World Socialist accusatory, right? But how are they counting everybody's private medical bills, or are they counting the expense to which the government spends on it? You know what I'm saying? Well, if they're adding up everybody's doctor's bills in an exponentially more expensive healthcare system because of the centralized protocols of the government, and programs, government-funded programs that come with it. I don't know. But it's just a question there. It's just that whole equation. There's something wrong with that whole equation, the way they do that. But that's what collectivist revolutionary accusatories do. They just push the narrative of the revolution. And you're just supposed to buy it, right? Despite spending more on healthcare than any other country, this is the quintessential accusatory. Despite spending more on healthcare than any other country, both overall and on a per capita basis, the United States does not provide universal healthcare, resulting in preventable deaths and excess costs. So they say, right? With over 973,000 reported deaths attributed to COVID-19 as of March 2022, the United States represents 16% of the documented worldwide mortality burden of the virus, while only comprising 4% of the global population. Now, if you notice, too, that represents only 4% of the population. They do the same thing with our criminal justice system. They do this. America represents, has the least amount of population versus, the most people incarcerated. They do it all over. They use the same equation, platform, to shit on America on a multitude of, subjects. Critical theory. That's what critical theory does. Despite spending more on healthcare than any other country, the United States does not provide universal healthcare, resulting in preventable deaths. So we don't have universal healthcare, so these people died. I'm just saying. Not all disparities in COVID-19 mortality could have been alleviated by adoption of a single-payer universal healthcare system. Oh, really? Even in countries with single-payer healthcare systems, there can be a steep income gradient associated with COVID-19 outcomes. Steep income gradient associated with that. So, while single-payer healthcare is paramount to addressing health disparities in the United States, the challenge is multifactorial. Pervasive inequities regarding income, education, and housing impact nutrition, mental health, exposure to pollution, and feasibility of accessing healthcare services. Paid sick leave, nutrition programs, and affordable housing are among initiatives that are necessary to alleviate disease burdens overall and mitigate systemic gaps in health. You know, oppressed of America unite. Medicare for all as pandemic preparedness. The COVID-19 outbreak has underscored the societal vulnerabilities that arise from the fragmented healthcare system in the United States. Universal healthcare coverage decoupled from the employment. Sorry, I learned how to talk. Still learning how to talk. Universal healthcare coverage decoupled from employment and disconnected from profit motivations would have stood the country in better stead against a pandemic. Emergence of virulent pathogens is becoming more and more frequent, driven by climate change and other global forces. Universal single-payer healthcare is fundamental to pandemic preparedness. And maybe, you know, the temperature of the world will go down too, and the oceans will recede and the ice caps will come back. Just saying. The urgency of universal health care coverage policy for the implementation of public health services during the COVID-19 pandemic. This was from July 2023. Come on. There we go. This is from Indonesia. This article came out in Indonesia. Okay, just another little something on here. In the introduction, the state is the only foundation and hope for the community during the COVID-19 pandemic, which has claimed many lives at this time. The state as the only hope, the only means by which any of this is the mindset. And you can't say that mindset hasn't infiltrated and taken over the American people. Or we wouldn't have the populist nationalist on one side and the leftist communist on the other side. Politics in America, pretty much. The collectivism has infiltrated American politics, left, right, center, Democrat and Republican. The state is the only foundation and hope for the community during COVID-19 pandemic, which has claimed many lives at this time. The modern society, the state must fully guarantee the rights to the freedom of individuals and communities of citizens, the safety and security of their property. Really? As well as their body and soul. Oh, so now they have a soul. These rights are known as basic rights that are given, which in the context of the development of a modern state are then referred to as a fundamental rights or human rights. So these rights are going to secure your property as well as your body. And they're saying that what they're referring to is the collectivism of human rights, in which your property don't mean jack shit, because in collectivism, property can't mean jack shit, because as Karl Marx said, communism abolishes private property. So what property are they talking about? What property are they talking about? Whatever ration of redistributed wealth that the government issues you at the time that it's issued, as per the needs of the planners, subject to change according to the needs of the planners. I don't know. But that's where we are. Just another angle on the same world collectivism in the accusatory, right? This is from the Commonwealth Fund. America's, no matter the state they live in, die younger than people in many other countries. Of course, this is the Commonwealth Fund, big pusher of universal health care. That's from the Commonwealth Fund. And right there, so let me see, the Americans, no matter the state they live in, die younger than people in other countries. Because it's an opportunity to shit on America, basically, is where we are, right? Then you've got this Mirror 2024, a portrait of the failing U.S. health system comparing performances in 10 nations. So they're going to compare the United States performance in 10 nations. The Commonwealth Fund is going to do this, okay? That's it right here. In this article, like I said, September 2024. In this edition of Mirror, right, we compare the health systems of 10 countries: Australia, Canada, France, Germany, and the Netherlands, New Zealand, Sweden, Switzerland, in the United Kingdom, and the United States. What other country besides the United States there doesn't have universal health care? Or isn't a full-blown socialist country? Just asking. We examine 5 key domains of the health system performance: access to care, care process, administrative efficiency, equity, and health outcomes. Each is defined below. Despite their overall rankings, and all countries have strengths and weaknesses, ranking in high in some dimensions, lower in others, blah, 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 blah. The top ranked country was Australia. Even the top-ranked country, Australia, does less well, for example, on measures of access to care and care process. Well, they got a lot of desolate areas out there. And even the U.S. with the lowest-ranked healthcare systems, particularly in relation to how much the U.S. spends on healthcare. Yeah, we spend the most, remember, with the worst outcomes. The ability to keep people healthy is a critical indicator of a nation's capacity to achieve equitable growth. In fulfilling this fundamental obligation, the U.S. continues to fail. In other words, another opportunity to shit on America. COVID, another. Right after COVID. Still shitting. Just within the past year or so, they're still shitting on America. Right? For not having universal health care. Which is part and parcel to top-down Soviet command and control public health policies, right? So got universal health coverage saves more lives among severely ill COVID-19 patients. A difference in differences analysis of individual patient data in South Korea. It's not just, so it's in South Korea too. Here's this article. Right. In the conclusion, right, during the pandemic, universal health care may have saved the lives of severely ill COVID-19 patients. Therefore, expanding services and financial coverage could be a crucial strategy during public health crisis. From Korea. I got the Sabin vaccine. The Sabin Vaccine Institute. Albert Sabin, right? This is from 2020. On Dr. Albert Sabin's birthday, his legacy is a reminder that vaccination and health equity go hand in hand. Pushing health equity, right? Dr. Sabin believed deeply that no person should be denied his vaccine simply by circumstances of birth, and he worked tirelessly to distribute his vaccine and connect global actors to advance mass immunization campaigns and ensure that no child was left unvaccinated. No child was left unvaccinated. top-down command and control. As COVID-19 vaccines candidates advance into clinical trials, this is from the Sabin Institute, it is imperative that vaccine nationalism start over with that. As COVID-19 vaccine candidates advance into clinical trials, this is back in 2020, it is imperative that vaccine nationalism, the my nation first approach to distributing a vaccine, be addressed head on. Vaccine nationalism versus the communism of universal health care. Right? Any vaccine that is not able to reach the most vulnerable among us will only allow the pandemic to continue. So if you don't get this vaccine, the pandemic's going to continue. Equitably distributing and allocating a COVID-19 vaccine will require immense collaboration and support, particularly for people who are in the front lines administering vaccines. At Sabin, we recognize that the systems through which, there we go with the systems approach, the systems through which vaccines are administered must be strengthened. The system approach, the public health care systems, the top-down command and control systems must be strengthened. And enforcement of and compliance are going to all have to be strengthened. Vaccines are one of the greatest, they're not saying that, but it's implied. You can't separate it from if you're going to push one aspect of that collectivism, all of that collectivism comes with it. Vaccines are one of the greatest tools for health equity today. That's the same collectivism right there. With the potential to free all people from the burden of vaccine-preventable disease and the capitalism that's stopping them all from having universal health care, right? But for vaccines to fulfill their full promise and potential, health equity must be prioritized from the start. For vaccines to fulfill their full promise and potential, health equity must be prioritized from the start. I don't know. And this whole vaccine nationalism thing, I said, do you think it's a coincidence that they're still utilizing internationalist language of the 1920s era scientific internationalism? We've already touched on it several times in this in past shows regarding the shared. And this vaccine nationalism here, I've gone over this in some several shows. This cosmopolitanism, it was just scientific internationalism, kind of prior and leading up to World War I and World War II eras, right? From that article, it's the same old 1920s era conviction that science would break the current trend of nationalism and jingoism. So science needs to break the trend of nationalism, and still today the Sabin Institute, Sabin Vaccine Institute, is still utilizing the same language, putting it out there, the same nationalism language. Just saying. And the other thing I'd like to point out, is that these recent COVID vaccines, just another similarity. One of the big things that they came out was Kevin McKernan made a big deal. I remember he had Naomi Wolf on his show. Naomi Wolf went to his lab and they had all these PCR tests where he said he discovered DNA. He discovered what? DNA, and I think SV40 in the vaccine. So it came to be a big deal among the anti-vaxxers and social media and stuff. Oh, we got this, SV40 cancer-causing sequences in the vaccine. It's weird. This is weird. Okay, here's an article from 2005. Some oral polio virus vaccines were contaminated with infectious SV40 after 1961. This is the same shit all over again, right? The same all over again. I don't know. Just rinse and repeat, dude. If it works, use it again and again, right? Yeah. Oh, and guess who's an article? One of the authors on this is Konstantin Chumakov, our recent head of or assistant director or whatever it was of vaccine research and safety at the FDA during COVID, while the COVID vaccine was approved for public use. I don't know. But anyways, in this article, okay, this is it. Cancer research. Okay. Again, Konstantin Chumakov, one of the co-authors on this article. Abstract. Mikhail Chumakov's son. Some polio vaccines prepared from 1954 to 1961 were contaminated with infectious were contaminated with infectious SV40. Konstantin Chumakov's an author on me. Is this bullshit? This guy was just, a bigwig in the FDA here, and is he full of shit? I don't know. It has been assumed that all polio vaccines were SV40 free in the United States after 1961 and in other countries after 1962. Following a WHO requirement that was promoted by the detection of SV40 in some human tumors, we conducted a multi-laboratory study to test for SV40. Polio vaccines prepared after 1961. The vaccine samples from 13 countries and the World Health Organization's seed were initially tested by PCR. The possible presence of intact and or infectious SV40 DNA in PCR-positive samples was tested by transfection, and infection of permissive SCV1 cells. All results were verified by immunohistochemistry, cloning, and sequencing. All vaccines were SV40 free except for vaccines from a major Eastern European manufacturer that contained infectious SV40. From the Eastern Bloc communist countries, right? Eastern European on the communist side of the Iron Curtain, right? We determined that the procedure used by this manufacturer to inactivate SV40 in oral polio vaccine seed stock based on heat and inactivation in the presence of whatever did not completely inactivate SV40. These SV40 contaminated vaccines were produced from early 1960s until about 1978 and were used throughout the world. So this whole SV40 contamination of vaccines really isn't anything new, right? I mean, it's nothing new. And its source was the Eastern Bloc communist countries. So they say. I don't know. Our findings underscore the potential risks of using primary monkey cells for preparing polio virus vaccines because of the possible contamination with SV40 or other monkey viruses. Oh, monkeypox. Maybe that's how we got monkeypox, from the vaccines. And emphasize the importance of using well-characterized cell substrates that are free from adventitious agents. Moreover, our results indicate possible geographic differences in SV40 exposure and offer a possible explanation for the different percentages of SV40 positive tumors detected in some of our laboratories. And that was written in 2005. With Konstantin Chumakov as a co-author. SV40, Kevin McKernan's, wow, amazing, just holy shit, revelation that we've got SV40. Holy shit, in the COVID vaccine. I don't know if you listen to Jonathan Cooey, Dr. Jonathan Cooey at Gigaome Biological. I mean, that SV40 is pretty much everywhere. Anybody who's using it in a laboratory on the bench is, I don't know. Right? So I don't know. But just another example of in history repeating itself here. I got the Chumakov connection here. I'm going to top, kind of bring this to a conclusion here on the Chumakov connection to kind of reiterate this thing. Evaluation of quality of viral vaccines based on a molecular consistency. Here's an article by Konstantin Chumakov, right? From the FDA. As official part of the, right? And it says that the bio sketch here, Dr. Chumakov is a graduate of Moscow State University, holds a PhD degree in virology, the Doctor of Science degree of molecular biology from the same university. The guy goes down through his bio. But anyways, let me see what I got from this here. His bio sketch, all right? In 1973 to 87, he was a research scientist at the Laboratory of Molecular Biology and Bioorganic Chemistry of Moscow State University. So he was working for the government, right, of Moscow. From 1987 to 1989, he was a chief of the Laboratory of Bacterial Genetics at the Institute of Microbiology of the Soviet Academy of Sciences in Moscow. Still working for Moscow government, right? For Russian government. Dr. Chumakov moved to the United States, moved to the U.S. Food and Drug Administration Center for Biologics and Evaluation and Research in 1989. That's the year I met my wife. Where he is a principal investigator and laboratory chief in the divisions of viral products. In 2008, he has served as an associate director for research in the CBR's office, in the Biologics Evaluation and Research Office of Vaccines Research and Review. He is also an adjunct professor at the Georgetown University at the University of Maryland and the director of Global Virus Network. Okay, Center of Excellence. He is an advisor for the World Health Organization and a member of the WHO Polio Research Committee. All right. Chumakov, history repeating itself, right? His scientific interests are in poliovirus biology, informatics, as well as the creation of molecular methods for evaluation and quality control of vaccines and other biological products. In general overview, FDA carefully evaluates the safety and effectiveness of vaccines both before and after that they reach the market. This is coming from Chumakov, right? Right? This is released by Chumakov. Konstantin Chumakov, the son of Mikhail Chumakov. General Mikhail Chumakov. Wasn't really a general, they just called him that, I think. I don't know. FDA carefully evaluates the safety and effectiveness of vaccines both before and after they reach the market. These evaluations, which are done in both test tube studies as well as animal models, are often labor-intensive and time-consuming. Our laboratory is adopting cutting-edge tools of biotechnology to make the design and evaluation of new vaccines more efficient. Blah, 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 blah. Moreover, FDA's proactive research also greatly facilitates regulatory evaluations of these products, reducing the time needed to approve vaccines and reducing the time needed to approve vaccines and make them available to the public. Consistent with the international, which is consistent that speeding up the time, the vaccine, development is consistent with the international R&D platform global World Health Organization led R&D blueprint for research and development shortcuts, which was, I've gone over in another show before too. Okay. This is the WHO Research and Development Blueprint, evaluation of ideas for potential platforms to support development and production of health technologies for priority infectious diseases with epidemic potential. This is just, I've gone over that whole platform, that whole push for R&D, the R&D blueprint that was supported by BRICS nations countries. Yeah. But also note that the papers regarding polio vaccines co-authored, they're co-authored by Robert Gallo. No. Oh, yeah, see, a lot of these down through here. You've got this says in publications and stuff like that, they go down through here that the FDA, according, this is Konstantin, right? Konstantin Chumakov, right? From the Office of Vaccines Research and Review Division of Viral Products Laboratory Methods Development. Konstantin Chumakov. I'm telling you. Then you go down through here and then you have publications. And I got, you got Chumakov, right? Konstantin Chumakov. And who else do you have in here? Gallo. He co-authored a lot of articles with Gallo. I mean, a lot of these articles are co-authored with Gallo. Let me see. There's a couple of them on here. Let me see. There's 3 of them. 1, 2, 3. Okay. Just putting it out there. Just putting Robert Gallo co-authored some articles with this guy. Also, the other thing is that Robert Gallo was the founder, the living legend Robert Gallo was the founder of the Global Virus Network. Okay, and I wanted to show you this too. Let me see, where are we going here? Yeah, I'm almost done here. I'm almost done here, P. I'm almost done, kid. Just give me a couple seconds here. Here you go. Here, one more. Give me a minute. Almost done here. I'm gonna wrap this all up so I can be done with this and you can have the information. Anyways, I wanted to go over this Robert Gallo thing here from the Global Vaccine Network, okay? He's a living legend, all right? They refer to him as the living legend. Okay, it says Dr. Gallo and his colleagues were important participants in the NCI-led project with the Burroughs Wellcome Fund. Welcome? Is that like the Wellcome Trust Fund? I don't know. To develop the first AIDS therapy, the antiviral drug AZT. The early 2000s, Dr. Gallo and his colleagues at IHV developed a vaccine candidate for HIV that is currently in a phase of clinical trial in Thailand. In 2011, Dr. Gallo co-founded Global Virus Network, a coalition of eminent virologists working to end viral threats. With the onset of the COVID-19 pandemic, Dr. Gallo, with his Global Vaccine Network colleagues, notably Konstantin Chumakov, son of Mikhail Chumakov, right, authored 2 studies that suggested that the oral polio vaccine made from a live weakened virus may protect people from the SARS-CoV-2 vaccine. So, coincidentally, and conveniently, the polio virus vaccines and mass vaccinations and public health policies that became the envy of the world, soon to be policies of the world through World Health Organization adopting them, and other countries, including the United States, adopting them. Also, the vaccines for that polio could also be used for this new pandemic, which conveniently is kind of pushing for that same world socialism, top-down command and control public health, as demonstrated by Mikhail Chumakov Now his son, Konstantin Chumakov, along with Dr. Robert Gallo and the Global Vaccine Network of Virologists, are calling for the same, saying that same vaccine for that pandemic could be utilized for this pandemic. And, of course, the added instrumentation of the top-down command and control public health. Yeah. With the onset of the COVID-19 pandemic, Dr. Gallo, with his global vaccine colleagues, notably Konstantin Chumakov, authored 2 studies that suggested that the oral polio virus made from a live weakened virus may protect people from SARS-CoV-2. Dr. Gallo has published more than 1,300 scientific papers on and a book, Virus Hunting, AIDS, Cancer, and the Human Retrovirus, a story of scientific discovery, which has been published in 12 languages. Dr. Gallo was the most cited scientist in the world from 1980 to 1990 and was ranked 3rd in the world for scientific impact from 1983 to 2002. Not small potatoes, right? In 1996, Science magazine named his team's work the breakthrough of the year for demonstrating that certain cytokines could inactivate the HIV virus. Dr. Gallo holds 35 honorary doctorate degrees. Right? A sampling of his most prestigious international awards include Canada's International Award, the Japan Prize of Science and Technology, Germany's a prize from Germany. India gave him a prize. France gave him a prize. Spain gave him a prize. Israel gave him a prize. And all the same countries that kind of push the polio vaccines too, right? A lot of them. Italy, right? China. And the World Health Organization, of course, all gave him prizes, right? And the World Health Award from the former Soviet Union from President Gorbachev himself, right? I don't know. But anyways, I got more on this, global vaccine network that, from this article. I'm almost done, P. Look at this guy. You got the picture right here. Who's this guy? Konstantin Chumakov, also a member of Gallo's Global Vaccine Network. Okay. It's an interview that they did with Chumakov here. And one of the things I wanted to point out here is, as a part of the international consortium assembled by the Bill and Melinda Gates Foundation, this lab is participating in the development of a next-generation genetically stable oral polio vaccine. Since the beginning of SARS-CoV-2 pandemic, we have been collaborating with Dr. Gallo and his team on promoting novel disease prevention strategies based on non-specific protective effects induced by live viral vaccines. And then I got this Global Health Chronicles here. Where Dr. Konstantin Chumakov. Just another article kind of pushing that forward. So basically, I just wanted to get down through here who this guy Konstantin Chumakov was from our FDA, how he gets tied in, the Chumakov connection, And that pretty much wraps it up for the last 6-8 shows that I've done. I kind of went into a deep dive, and it's weird that it all kind of stemmed out of watching couldn't get past the first 3 minutes of a video on a demonstration or presentation that was done by Melissa Chen on how she was wanted to preserve the elements of the Enlightenment from essentially what are elements of the same Enlightenment that are fighting against the elements that she agrees with? I don't know. The same evolutionary, atheist, new atheist, evolutionary genetics and how it all rolls into all this, and this top-down command and control, the Lysenkoism that was top-down command and control, genetics that wound up getting blamed really for. Lysenko winds up getting thrown under the bus in a lot of academic paperwork for really what was directly caused by communism and socialism itself. The advance of communism and socialism, the totalitarian advance of that same world socialism that's now pushing for the world socialism of, public health, using epidemics as a fulcrum, lever and fulcrum to advance it. And today still that they're still shitting on America for using the recent COVID-19 pandemic, right? Alleged pandemic as a lever and fulcrum to advance the same world socialism, the same public health. See public health for what it is, because I've laid it out here. I'm not making this shit up, and it's not in my head. I've laid out enough evidence to the fact that I don't know, my observations aren't wrong. I'm Joe Marshall. Thank you for stopping by the Liberty Perspective today. I hope you got something out of it. If nothing else, the information's out there. The history is documented. The transformation, the fundamental transformation of what health is and was to from what health was to what public health is today. I've laid it out there for you. Thanks again. See you on the next show. Take care.